to you. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. So today is Friday as of the shooting of this video. Um, it's actually warm out here. It snowed 2 days ago. You saw my previous video, and now it's warm. There are birds and bugs out here. So I'm here in Washington, D.C. I wanted to talk to you guys about something that I saw whilst just browsing the internet last night, and it was a video of a doctor, a couple of doctors who were touting their book about. I'm not going to give them free advertisement. They were touting a book that they had written about how they believed that physician assistants and nurse practitioners were putting patients at risk because they have increased autonomy. And it's a lot of what I heard this one of the doctors say really had more to do with money, just from my perspective, than what I felt to be a genuine concern about patients' care and safety. I cannot speak for nurse practitioners. I will not dare try that. Every time I think a PA does that, some disgruntled person writes in the comments section, "You got it wrong. How dare you say this about NPs?" So if you notice, if you've been following me for a while, I've always interviewed a nurse practitioner or a certified registered nurse anesthetist and let them talk about their profession. But I will talk about a PA, since I've been a PA for more than 20 years now. I think that there is still a lot of education that needs to be done for doctors, especially doctors in certain areas, when it comes to their knowledge base about physician assistants and their scope of practice. You know, physician assistants don't want to take over for doctors, and I think there's some fairly aggressive legislation that's been passed allowing physician assistants to have this expanded autonomy. And from what I understand, this is really in very rare instances. There's a PA out in Nebraska who runs two practices. He does have a supervising physician with whom he works, who is in another location. But this is a very rare instance. If that PA were not there, there would not be any type of health care. This is a very rural area, small town in Nebraska. I forgot the guy's name. You can look it up on YouTube. Personally, I've always worked in inner city clinics. That's a passion of mine. I'm a black guy. I'm from the inner city. And that's my particular group. It's my particular interest. So I've been very passionate about trying to render what I feel to be very efficacious care among that group, in particular with health education and preventive measurements. I'm going to try to get black folks, before we get dependent upon dialysis, or before we die of the cancers from which we die, before we get AIDS, yeah, before we get heart attacks from clogged arteries. So that is not necessarily something that takes a doctor to do. That deals with a lot of things like a behavioral health belief model, and that's why one of the reasons why I got a doctorate. But I've always worked very pleasantly in conjunction with a supervising physician. I don't think it's a good idea for PAs to have full autonomy like other groups. I certainly, I'm not a particular big advocate of the name change. There's this thing about calling physician assistants physician associates. I'm certainly not for a doctorate of physician assistant. I wasn't a very big advocate of a master's. It's kind of like this racing of degrees. Well, hey, they got a bachelor's, so we got to get a bachelor's. We used to be a certificate program. Then other groups got an associate's. Then we got an associate's. Then other groups got a bachelor's, so we had to get a bachelor's. Then other groups of professionals got a master's, so then we PAs got a master's. Then the other groups are getting, the PTs, physical therapists, and occupational therapists are getting doctorates. Now the nurse practitioners are getting DNPs. So then there's PAs. They're like, well, we got to get a doctorate. What are you going to do? Walk around calling yourself Dr. PA? It's kind of ridiculous to me. And then with the cost of college, it's just going to cause an even more of a burden for financial aid and things like that. Yeah, it's just, and it's not really going to benefit the patient any. But for physicians who feel that PAs in particular are trying to encroach upon their turf, I would caution them before writing another version of their book or having another conference of why PAs are trying to take over their turf. Really educate yourself about what PAs do. Come to some of the AAPA meetings, the American Academy of Physician Assistants. We've had some really great PA advocates coming from the medical profession. In fact, it was Dr. Eugene Stead in 1967, if that date's correct, who created the idea of physician assistants. It wasn't some disgruntled person who didn't get into medical school and then decide to start the PA profession. It was actually a licensed physician. So there's plenty of sick and injured people to go around, and if you don't agree with the idea of expanded practicing privileges, lobby Congress. Capitol Hill's kind of on lockdown now. I pass it every day. I see the armed guards out there with the 20-foot high fences with the barbed wires. But you can lobby Congress. I did some lobbying years ago. I got to meet with congressmen and congresspeople and senators on behalf of PA Advocacy. And as past president of the DC Academy of Physician Assistants back in 2004, I can tell you we never tried to forward any of our legislation without first checking with the AMA or the DC arm of the AMA. So what do you guys think of this? You guys are licensed supervisors. This is what we would like to do. What are your thoughts about this? Yay or nay? We don't, very few of us are cowboys. I've only heard one physician assistant in my 20 years of PA say something like, well, we know just as much as the doctors do. We should get paid the same, or we don't need them telling us what to do. That's one one PA out of, I forgot how many PAs I've worked with. That's out of 20 years. I don't even know if that PA is still practicing anymore. But I've enjoyed a very good professional dynamic and good collaborative relationship with my supervising physicians over the years. So you needn't fret. A lot of these things, the PA salaries are going up because of reimbursement issues. There's a lot of doctors that are getting older. It does take almost 15 years for somebody to come out of high school to finally become a full-fledged independent doctor. 4 years undergraduate, 4 years med school, at least 3 years of residency for an intern, and then probably a fellowship if you're going to specialize. It's a long time. We PAs can help out. It's in our name, physician assistant, or even if we call ourselves physician associate. So you needn't fret. But for those of you guys that want to become PAs, I wouldn't really worry too much about these very few doctors, but do know that they are out there. We can reach out to them. We'll educate each other and work together. But if you're interested in becoming a PA, please subscribe to my channel. You can reach me on Instagram as well. Wish you guys the best of success in your positive endeavors. Peace.